Hi, I'm Dr. Greg Castello, board certified family practice, and we're going to talk today about what kills Americans. Number one leading cause of death in the United States is heart disease right now, with about 600,000 deaths per year associated with heart disease. A very close second is going to be cancer. All cancers added up equal about 575,000 deaths. It's projected that cancer is going to pass heart disease in the next 10 years, not because of the increase in cancer, but because of the decrease in death of heart disease because of modern medications like cholesterol medications. A very distant third is emphysema and lung diseases at about 175,000 per year. This is mostly smoking related. Number four is strokes at about 130,000 deaths per year. And number five, interesting, is influenza and pneumonias at 54,000. This is conceivably preventable with flu shots and pneumonia shots, but we still have over 50,000 deaths per year because of influenza. When we add up heart disease and stroke, that's about 1/3 of all deaths. So as a general rule, you've got a 1 in 3 chance of dying of heart attack or stroke. When we look more closely at cancer deaths, the vast majority are going to be lung cancers at 28%. That leads the list, and this is primarily smoking related. A distant second is colon cancer at about 10%. This should be almost completely a zero number. If we go for routine colonoscopies, this should be a preventable cancer. Breast cancer, which seems to be on the forefront of attention, is actually third at 7.4%, so a very low number associated with breast cancer deaths. Number four is pancreatic cancer at 6%. We don't see a lot of pancreatic cancer because it's so fatal. We see a higher percentage of deaths. And number five is prostate cancer. We do see a lot of prostate cancer in older men. It's such a slow-growing cancer that although it's fairly prevalent, the actual number of deaths is low at 5%. I went ahead and I looked at what do people die by age group, and from age 1 to 44, the most common cause of death is injury, unintentional injury, mostly related to motor vehicle accidents, but drowning and falls and other unrelated traumas. At about age 15, we see our first spike in suicide and homicide, with about 5,000 people a year dying of both homicide and about 5,000 people by suicide. This continues up until about age 45, so you can look forward at age 45. You don't have to worry so much about dying in a car accident because your risk of cancer death and heart disease death passes the risk of injury for the first time. And we see about 50,000 people in that age group dying from heart disease and cancers for a total of about 80,000, which overcomes injury. By the time you get to about age 55, your risk of dying in an accident or injury actually drops to number 6, with heart disease, cancer, stroke, diabetes, and other conditions 1 through 5. So in the United States, heart disease is our number one killer. Eventually you may get heart disease, but these are very preventable, treatable with current medications, diet, lifestyle, exercise. There's a ton of different cancers out there, but the big three are lung cancer, colon cancer, and breast cancer. Lung cancer, don't smoke, obviously. Colon cancer, go get your colonoscopies. It's actually preventable. And breast cancer, although not preventable by getting a mammogram, is treatable, so follow the recommendations of your doctor and get breast cancer screening as early as age 35 if you've got a family history, or 40 for most women. The government is still saying age 50 for breast cancer screening. This is more of a monetary consideration. The number of women that we screen between age 40 and 50 is low enough that they don't think it's worth doing screening in that age group, but I do recommend a baseline at 40 for asymptomatic women and 35 for women who have a family history of breast cancer. Okay, get your flu shots. 55,000 people a year, more than die in automobile accidents, die from influenza. So kids and adults should get flu shots. If you're over age 60 or 65, you should get a pneumonia shot. Be healthy, be safe. Dr. Greg Castello, thanks.